I think you're all mostly familiar with this. We bring down 7 to 8 teams at a time down to the Wiser Center. We're going to ask the P2 students to arrive between 1 and 1:05 p.m. And we try to ask them not to come too soon, we don't want to clog up the lobby area at Wiser. We're going to ask them to go directly to the Met rooms, and we're going to try to start about 1:05 p.m. And if you don't mind keeping time in your room, we're going to try to keep the simulations at 20 minutes. So that would bring us to 1:25, and then they're going to go to the classroom for debriefing at 1:25. So as you can see, we're going to do that rotation. We're going to, go through that about 3 sessions. We're going to pair you up. There's going to be 2 facilitators per room. Feel free to switch up, work with whoever you would like. So each of you should see 3 P2 teams. There's, I think, about 3 sort of tasks you need to perform during the simulations. We're going to need somebody to operate the software, and in a second, I'll provide you a brief overview of the Laerdal software. We're going to need somebody to score the case with the rubric, and somebody else to use the facilitator guide to keep the case moving forward, answer any questions that students may have, and sort of just be the lead for the case. The Laerdal software, I don't think any of you have seen this yet. It's pretty simple. These cases we use at Wiser, they're all pre-programmed in the Laerdal software. And of course, Laerdal is the company that makes the simulators that we use, SimMan, yeah, Nursing Ann. But it's pretty self-explanatory here. The case should appear in this state once you enter the Met room, and Met stands for Medical Education Theater. But you're going to click Start Session. Basically going to be set up like this. You're going to have your correct treatment. Students make the correct recommendation for antihypertensive. It's programmed to respond accordingly. So what you see here on the patient monitor is what the students will see on the patient monitor in the room next to the patient. In this area down here, you can kind of see the systolic and diastolic blood pressure trending down. So that's what that means right here. That's under the prediction tab. So our blood pressure is coming down. I can click continued BP drop, and looks like our blood pressure is going to come down even more. So pretty easy to use. There's one related events or incorrect events, no recommendation, something bad is going to happen. Yeah, some of these
Oh,
events that you click on will
oh.
make vocal sounds occur. Maybe if your mannequin blinks, maybe the simulator's eyes might close, things like that. But while you're facilitating, you can also make things happen on the fly, which means it's not programmed in.
You've all seen it before. Typically, the controls and features that Larry went over in the Layerdale software are correlated with the facilitator guide. So you guys probably remember that as students, the students have access to the EHR Go before class, where they spend time kind of cramming like a SOAP note and a plan for the patient. There's certain information that may look a little bit different when the students get into the room. So the first couple sessions, the students are kind of still learning about how to present these patients, how to work together, how to use their drug information resources. So at first, as facilitators, you guys might need to use like some probing questions to get them talking or get them thinking. But again, you'll have a facilitator guide, which will give you a brief introduction to the information that the students have seen in EHR Go. And then you'll have some key, likely talking points as facilitators. So sometimes you'll play the role as like an attending or as a nurse to sort of set the stage for the simulation. And then based on what the students are saying, the correct and incorrect responses, again, are correlated with certain hemodynamic changes or reactions from the SIDMAN. And that's basically like a general layout. At times, there'll be certain twists. So students might or might not have the same experience that we'll plan to debrief them on, when they're done with the simulation. So typically the first one is a little practice run, but all of our sessions will have a brief introduction before you guys go in, to just familiarize you all again with the case. You'll have access to that facilitator guide, usually a day or two in advance. If we can get it out to you sooner, we will try that, but definitely at least a day or two before those Wednesday sessions. So you have a chance to review and then ask any questions during our review session right before the students come in. Dr. Coons, I don't know if you wanted to add anything else that's been helpful for the students in the past.
I mean, that's a great overview. I guess just briefly, I mean, you all have been on the other side, right? So you remember what it was like going down there. You're probably a little bit nervous, not sure what to expect. I would also view kind of this session as being more introductory and low stakes. We want to get them comfortable kind of working in groups and collecting data, organizing their thoughts and just getting, a comfort level at the bedside and with what we're trying to accomplish with them. So keep that in mind too. From your standpoint, you've not served as a facilitator before, and you may be a little apprehensive as well, and that's okay. That's normal. I mean, from a clinical standpoint, I mean, we're here to support you. So we'll have plenty of time for questions and discussion. From a technical side, you'll have Larry and you'll have time in the rooms. And I think with this case, it's a good one to start with because there's not too much programming involved and, you can make adjustments, on the fly as needed. The last thing I would say is just to kind of set the stage. I think sometimes there's a little bit of confusion amongst the P2 class about what the setting is supposed to be, and what your role is as the facilitator. And what I always tell the students is that, you basically are there as the facilitator, but also in some respects as the patient's advocate. So if they had additional clarifying questions about the patient, you can kind of play the part of, the caregiver or, the family member, whoever, or the friend that can answer on behalf of the patient.
And I think it was mentioned that we will have, before each of the simulations, we'll have a chance for you to, ask us questions or ask, Dr. Coons and Dr. Clarkson questions about the case. So
I think the other job we would ask of you as facilitators is to get them to talk. Because you're going to find there's a lot of groups where they're just very reserved and even afraid to speak up, afraid of making a mistake. And that's the point of all this, is to get them to, to have that comfortable environment, right? That safe space, as we call it, where they can make mistakes and they can see the impact of their recommendations and what the medicine does to the blood pressure and the other vital signs. So if you're finding that, it's only one member of the team that's kind of speaking up or they're all really quiet, see what you can do to just get them to talk.
Yeah, I think so. I think for those of you that have the chance to participate in, the first and last sessions, it'll be very cool to see the progression and how interactive the groups become. So again, we do rely on you a little bit more so even in the beginning to kind of help stimulate that conversation. But I think you'll have fun. Definitely less pressure to be on this side of things. So thank you all again. We really appreciate your help.
Yep, and this is also, I guess, in a way, thinking of it as a practice for you to be a facilitator and help us during our the simulation final.